Hi folks, I'm Dr. Fazil. You're watching October 2025 edition of Dr. Fazil TV show. So the topic for today is of discussion is the knee pain, which is a very common problem. So let's talk about it. Before I start, I'm going to use also some holograms in my discussion so I can demonstrate in a better fashion the anatomy of the knee and then what can go wrong, what caused the pain, and would be the treatment options. So folks, here's the knee, and you can see the knee. This is the bone from the top, that we call it femur, and then this is tibula and fibula, and this is the kneecap in the front, patella, right? So the knee joint is complicated. Let's keep this hologram on the side. As a matter of fact, let's bring another hologram, and you can see there are the top portion of the knee and the bottom portion of the knee. At the bottom portion, we have this shiny surfaces known as meniscus, lateral meniscus and medial meniscus. The one inside is known as medial, one outside is known as lateral meniscus. And then on top, in between, we have those two tendons, which are holding the knee together, and then the tendons on the or I will call ligaments. So ligaments on this, we call it cruciate ligament, and then there's the ligaments on the side. Ligaments are like a band of fibrous tissue, which are keeping these knees together, the bones of the knee together. And pretty much what happened is when let's bring another hologram. You can see when the knee moves, the top bone glides on the bottom bone through interaction of the meniscus. Meniscus is a slippery surface, So folks, what happened with let's keep that hologram on the side. What happens is that with trauma, injury, or with wear and tear, there might be some cracks. Let's bring another hologram. You can see there's a crack going through and through the meniscus, and that become painful as the knee, the top bone grinds on the bottom knee, on the bottom bones of the knee. It will cause pain. Sometimes you can have a loose bone fragment inside the knee that can also get stuck and cause pain. Sometimes you totally lose the meniscus of the knee, and then we call it bone and bone. You can see right here. You can see the meniscus. That's the normal meniscus. Let's have this hologram go away and then bring another one, and you can see there's no meniscus left. So either you can have a cracked meniscus or no meniscus, and then we call it bone and bone, or you can have a loose bone fragment inside, which can be grinding your bone, or another issue, which could be strain on the ligaments or the ligaments which hold the knees together, or bruise or trauma to the bones by itself, or the combination of things. So basically, it's not just simple one thing, but most common thing is bone on bone. We call it osteoarthritis. Osteoarthritis of the knee is the most common condition of the knee pain, but folks, do remember that knee pain could be due to a lot of other things like gout, so don't forget gout. So if you eat a lot of heavy protein diet and immediately you have a pain in the knee, that could be indication of gout, could be diagnosed with checking the uric acid level of the blood. And obviously, if that's the diagnosis, the treatment would be stay away from the heavy protein intake, and then also use medication which are anti-inflammation medications like ibuprofen, Morphine, Aleve, or steroids, depending on case-by-case basis. So folks, that's kind of like two common causes like gout, osteoarthritis, and there are other causes too. Remember, if you have multiple joints involved, it might be totally something else, like psoriasis, the skin condition. As you can see, the hologram, you can see the psoriasis. The people who have psoriasis sometimes have joint pain as well. So we call it psoriatic arthritis, right? And it could be also due to something else, other inflammation. So if you have one knee or two knees or multiple joints involved, then the diagnosis might be different. It could be lupus, or rheumatoid arthritis. Rheumatoid arthritis is inflammation. Remember, osteoarthritis is mechanical pain. The difference between mechanical and inflammatory pain is that mechanical pain gets worse when you walk, due to trauma, Well, inflammation pain gets better with walking because of the increased blood flow. So that's the common question I ask, if it gets better with walking, yes or no, and then we can go from there. Well, you still have to diagnose with, taking appropriate imaging modalities. For example, by doing an MRI or CT scan or X-rays or combination of all that, depending on situation. MRI is probably a better choice because it gives you the soft tissue imaging as well as the bones and everything else. So those are the common causes, right? Let's talk about treatment. So treatment would be, obviously, if the pain is just an issue and is mild to moderate, you can probably use on case-by-case basis non-steroidal anti-inflammation medications like ibuprofen, morphine, alleviate, naproxen. Make sure you don't have a kidney problem because that can mess up your kidneys. The other thing is that sometimes if the pain is worse, you can have a cortisone injection. Here's a hologram. You can see injection being given inside the knee joint. So that can also be good for a few months, sometimes more, depending on the cause and how much damage you have.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Well, folks, there's another treatment that is hyaluronic acid injections. So if you have a knee pain, the guideline is that you can have, let's do this, another hologram. You can see a hyaluronic acid injection is being given. So generally the treatment is one injection once a week for 5 weeks. And then it's like a viscous material, like you fill up the gaps between the meniscus, and it could be good for, in a good situation, it could be good for maybe a year, And then if it happens again the next year, you can redo the same treatment. As long as it works, is fine. If it doesn't work, then obviously, folks, if the pain is too unbearable, then besides the physical therapy, trying to build up the muscles, try to get pressure off from the knee, you will need surgery. So knee surgery is the last option. Here you can see how the knee surgery is done. You can see the knee is all metallic and it's all metal, and it gets connected with the bone on the top and bone at the bottom. And obviously, it's a mechanical knee, so there's no nerve receptors. So in good hands, you should not have any pain after that. But knee surgery we keep as a last resort. And when you have bone and bone, there's severe disabling pain. At that time, we can recommend, in appropriate situation, knee surgery by an orthopedic surgeon. But to prevent that outcome, I think the best option would be to watch out your knee health, make up your muscles, do muscle exercises, avoid trauma to the knee, and then obviously, lose weight, because you have too much weight on your knees, it will hurt your knees, just like anything else. So folks, that's my few points, bullet points for your knee pain, why you have knee pain, what causes it, and what are the treatment options. So hopefully that was useful, folks. On that note, thank you for watching Dr. Fazil TV show. We'll be back next month with a more useful topic for your information. Thank you so much, Dr. Fazil.